MediGroup Physician Services presents MediGroup's Frank's Fast Five with Healthcare Executives, produced by Bridget Wilson and Carrie Peters. Today's guest is Dr. Alidad Ghiassi, Chief Medical Officer for HIA Technologies. Now here's your host, MediGroup's Frank Gillespie.
Hello and welcome to another edition of MediGroup's Frank's Fast Five with Healthcare Executives. Today, I have the privilege of talking with Dr. Alidad Ghiassi, Chief Medical Officer for HIA Technologies. Dr. Ghiassi, it's an honor and welcome. How are you?
Great. Thank you, Frank. Thanks for inviting me. I'm so excited to be able to talk to you and your audience as well. And this is a great opportunity for everyone to learn what we're doing at HIA Technologies.
Absolutely. And it's an honor and privilege to speak with you as well. I know we've been on a number of phone calls and we both laughed here at the beginning because we really hadn't seen each other that much before. So awesome to be here in person with you. Thank you so much. So, Doctor, I promised you I wouldn't waste your time. I'm just going to jump right into these questions. And I know you've been briefed on those questions. So, Dr. Ghiassi, can you tell us just a bit about your background in the healthcare industry?
Yeah, no, sure. I've been in academic medicine for most of my career. I started at UCLA and then went to USC as full-time faculty.
Okay.
And I'm trained as an orthopedic trained hand surgeon. And I've been educating medical students, interns, residents, nurses, other faculty members, other hand surgeons, and orthopedists for the entirety of my career.
Wow, lots of background there. Fantastic. Thank you for that. But how has that background and experience, Dr. Ghiassi, contributed to your leadership of HIA Technologies?
Yeah, that's a great question, Frank. So back in 2017, I was introduced to HIA through USC's Institute for Creative Technology.
Yes, sir.
The ICT is really a center that's funded by the government and DARPA to bring new technologies into the commercial field and also to solve some of our biggest problems. And back then, when I was introduced to HIA, it was a newly founded startup, and its mission was to improve communication using multimedia technologies. And as a faculty member, and keep in mind, this is pre-pandemic,
Yes, sir.
we still had a lot of resources. I realized that our healthcare communication was broken, and we needed a better solution than a piece of paper that we give patients walking out the door. And HIA's innovative solution using avatars, virtual human technology, artificial intelligence, and then putting a control layer on top of it seemed like a very good way to start on this mission to really help connect our patients with our physicians,
Yes.
lowering the noise level in the room while providing accurate, important information to them at the time of their need. So that was the mission we started in 2017, and then put us through a pandemic and a resource-strapped environment where there's not enough time in the day, and there's too much information to be dispensed to patients. Our solution now really resonates well with not only our clinicians, but also our end users, which are our patients as well.
Yes, sir. And it's a fantastic solution. And that leads right next nicely into the next question. Can you explain Aivio and how did it come about and how does the patient and benefit and the providers as well?
Yeah, so HIA has actually two solutions. The Aivio is a web-enabled solution that allows avatars, which are tuned to your audience's preference to deliver complex information and provide interactivity. It does this by not only talking to patients, but also using multimedia resources such as videos, web links, static images, quizzes, surveys. It's the whole gamut of what you would as an educator need to educate your audience. All of that is done in a controlled environment, so the authors can maintains their agency and authority on the content,
Yes.
while the user has the accuracy, accountability, and convenience of accessing that information at any point. The Qvio, which is a video-based solution, allows standard videos to be now interactive, and it's really become the center of gravity for multimedia because not only can you ask questions from the video, but then you can embed other resources, including websites, other streaming videos, Google Docs, PDFs, and a layer of interactivity and analytics, which goes above and beyond anything that's out in the market today. So both solutions are designed to engage the audience and also to unload the physicians and clinicians from having to really participate in activities that provide value but are not reimbursed necessarily, and also are needed for proper patient care and journey.
Absolutely. And I think the interactive part is one of the most fascinating parts about that technology. So, can you elaborate just a little bit more? I know that wasn't one of the questions about the interactive part. How is that?
Uh, 100%. So, when we're talking about interactivity, it's really important to kind of step away from the hype that's out there with generative AI.
Okay.
Generative AI is a fantastic tool. It's a general purpose technology that's going to be part of our daily lives as we move forward.
Right.
But it doesn't have the proper control layer on top of it. And what we're able to provide through interactivity is to place a control layer on top of the interaction that allows those interactions to be controlled. So the one word that I want the audience to really remember is control, and it's really authored control or physician controlled AI. What we're able to do is to put safety and guardrails around the content, deliver that properly to the end user, have the right analytics, but also have transparency, accountability, and enough guardrails to make sure that the system does not go rogue and give you answers that are not curated by the author. So it's controlled interactivity. It's really taking all that power of AI technology and putting it in a funnel that resonates well with not only the users but also the content creators.
Absolutely. Healthcare control. I love it. That is just phenomenal. And Dr. Ghiassi, looking towards the future, what's next? I mean, this just seems like cutting edge right there. What do you see as next?
Well, let me get my crystal ball. No, but just kidding. So I see the future as being bright, especially in healthcare, because really if you're looking at innovations, the fax machine was the last innovation that was introduced into healthcare that helped improve things, right? So,
Yeah.
so I see the hype around AI slowly dying down over the next 2 years, and artificial intelligence is going to be integrated into a lot of the things that we do. And maybe even the term automation intelligence would be a different term to use for this, or augmented intelligence. But it's going to infuse its way into a lot of these repetitive tasks that are super important, but take a lot of resources to dispense. Um, I don't see it replacing jobs. As a matter of fact, I think that it's going to be a huge productivity boost to all sectors in our economy. I see it helping our physicians, clinicians, and patients in ways that we couldn't have imagined before, by really lowering um, that noise level in the room, by giving you the information that you need from the source that you also are demanding it from. And I don't see it as something that's going to really affect the workforce adversely. I think it's going to affect it very positively. And I say that because firsthand I've had the experiences in my own practice where these types of technologies, including what we are presenting at HIA, has improved my work efficiency and my patients' engagement with me as a provider.
That's fantastic. So, I mean, you've got something right there that not backs up, but associates with what you do, and you're able to use that technology yourself. That's fantastic.
Yeah, I eat my own dog food, so
Gosh, I'm glad there's not more questions. I'd learn a lot more. Dr. Gassi, I love it. This has been fun. And as a leader, how do you show appreciation for your team and keep them motivated? I know I've worked with a number of folks on your team. I love it. Responsive, knowledgeable, responsive. Fantastic group of people. How do you keep
yeah.
them motivated?
First of all, it's a big family. So Haya, I'm the team doctor here as well. So
Okay.
try to help people in any way that we can.
Yes, sir.
The motivation really comes through the progress that we've made with our solutions. And when you look around for meaningful application solutions that uses artificial intelligence in healthcare, and really focus on that meaningful solutions that can scale, that you can have in your hand today, there isn't much around. There's some tools that can act as co-pilots, this, that, and the other, but really that application layer that is meaningful, that can help people in a variety of ways. Um, We're one of those solutions, and there aren't too many around. I think you'll see potentially more as we move forward, but that is one of the ways that we really help the team focus is to show them the progress that we're making, not only on the patient front, but also on the partnership front. And they see the results, and it's an exciting time to be in healthcare. I mean, this is the renaissance of healthcare, right? I mean, moving
Yes,
forward,
yes.
we are going to see tremendous improvements, not just in patient communication engagement, but in a lot of different solutions as well. So it's a good time to be a part of this mission, and I think our team realizes that, and they've gravitated to our mission statement, and they're highly motivated to get the job done.
No question about it. Cutting edge technology, and that's why we're associated with you, and we appreciate it. I can't thank you enough for your time. I mean, we could talk for hours. This fascinates me, but I appreciate you taking a little snippet here and further bolstering the relationship. Dr. Ghiassi, thank you so much. I really appreciate your time. Thank you.
Frank, thank you so much. The pleasure is all mine. Yes, we can talk for hours, and when you get me going, I may not stop talking. So I
Okay.
appreciate you keeping me on task here, and hope to see you at the next one. And next time I'm in the great state of Texas, maybe we'll have coffee.
I would love it. Thank you very
Yeah.
much. Take
All
care.
right.
Thanks again.
Yeah. Have a blessed day. Talk
Okay,
soon.
you
Bye.
too. Thank you, sir.
This has been MediGroup's Frank's Fast Five with Healthcare Executives, produced by Bridget Wilson and Carrie Peters, and hosted by Frank Gillespie. Special thanks to Dr. Alidad Ghiassi, Chief Medical Officer for HIA Technologies. This has been a presentation of MediGroup Physician Services.